Bismillahirrahmanirrahim. Hi everyone. So now we are going to learn about oculomotor nerve, trochlear nerve, and abducent nerve, which are like very important for this eyeball and the extraocular muscles. So it is like very easy to understand. It's not at all like difficult. Okay. So if you just get to see the images and try to correlate it a little bit, also you will be able to understand it easily. Okay. So whenever it is a little bit tricky topic, I say it is easy. So think it is easy. It is going to be very much fun. Okay. Now let's begin. Oculomotor, trochlear, abducent. You know these nerves are cranial nerves, right? What do you mean by cranial nerves? Yeah, cranial nerve means their origin, their nuclei is going to be located from in the brain stem. Okay, so here this is the brain stem, and this is the pons. This is the, this is midbrain. This is pons, and this is medulla oblongata. And spinal nerves, they are going to have origin from the spinal cord itself. Like below this, we have the continuation as the spinal cord, right? So from there, the nerves are going to origin and form the spinal nerves. The nerves coming out from the brain stem is called as cranial nerves. We have 12 cranial nerves, out of which third cranial nerve is oculomotor nerve, number 3. Fourth cranial nerve is trochlear nerve. Sixth cranial nerve is abducent nerve. Okay. So now we are going to have like just an overview of the pictures, like how it is starting, where it is going, how it is coming out for the muscles. Okay. So first, do you see these red and orange part and these blue parts? They're all actually nuclei. Okay. You can simply know it as like the starting point, which is going to have the cell bodies of the neurons, which is going to form these cranial nerves. Okay. So remember, third nerve and the fourth nerve, that is oculomotor nerve and trigeminal nerve, are going to have their starting points, that is their nuclei in the midbrain. Okay. After that, the four cranial nerves, that is the fifth, sixth, seventh, and eighth cranial nerve. Okay. Starting from fifth to eighth, the origin is from the pons. The nucleus is lying at the pons and some extension also, but their attachment, their emergence is at the level of pons only. Next, we have the remaining four cranial nerves, that is 9, 10, 11, 12. Okay, those cranial nerves are going to emerge at the level of the medulla oblongata. Okay, and now let's start with the third cranial nerve, that is oculomotor nerve's origin. So here you can see one structure and two structure, right? So one is called as the motor nucleus of oculomotor nerve. What do you mean by motor nucleus? So it's going to contribute to all the motor innervation of that nerve. For example, it is going to innervate the extraocular muscles. Those fibers are starting from here. Okay. There is one more nuclei called as Edinger-Westphal nucleus. Okay. Edinger-Westphal nucleus. That is a little bit towards sensory side. So it's not here. We don't mention that here. Next nucleus is this guy. This small nuclei is for the trochlear nerve. Okay. And as you can see, this trochlear nerve is little bit oriented posteriorly. And you can see this nerve emerging from the posterior aspect of the midbrain. This is the only nerve emerging posteriorly. So this is a point we should know. Next, we have the sixth nerve's origin, which is abducent nerve. Here, do you see in the pons, just close to this region, this is basically our fourth ventricle. It's a ventricular cavity having CSF. Behind that, we are going to have this cerebellum, right? So in front of it, do you see this guy? And somebody is like winding around that person and going out, right? So the person who is like winding around, that is the facial nerve, okay? Facial nerve is the seventh cranial nerve. Now, within that, this guy who was like standing there, around which this facial nerve is winding around, that is the starting point of abducent nerve. Okay, so that is the abducent nerve nucleus, and you can see this red person, that is abducent nerve emerging here. Okay, so here this point, that is the junction of the pons and medulla oblongata, this point is called as pontomedullary junction. Okay, so there are certain nerves emerging at this line, at this junction. So for now, no abducent nerve is emerging at the pontomedullary junction, right? Okay, so we know like how it is starting. Now let's see how it is actually looking like if you see from the inferior aspect of the brain. Okay, so this is the inferior aspect of the cerebrum. We have the cerebellum. This is the anterior end. This is the posterior end. Okay, so imagine like my brain if it was like taken out and you're seeing rotated like this. Okay, from below. This is how it looks. So here we have the optic nerve, which we know already. Now we are studying about this nerve, which is oculomotor nerve. Okay, then do you see somebody like winding around from behind and emerging here just above this trigeminal nerve? This one is trochlear nerve. Last, we have this one along the midline at the pontomedullary junction. That is the abducent nerve. Okay, so this is how it's getting attached, emerging out of the brain stem. Then once it comes out, now so we saw the brain like this, we had the brain stem like this, the nerves were emerging out. Now I'm going to just put that brain into this cranial cavity. Now we'll have the brain stem lying on this portion, isn't it? This region is called as the clivus, like it's the resting spot for the brain stem. So if we have the brainstem here, can you imagine how the nerves would have emerged out like this? And then it's going to enter into different foramina, like to their respective spots. Okay. So in this picture, we are able to see the different nerves. All right. Now I'm going to identify it for you. First is the optic nerve here. Behind the optic nerve, we have this blue portion. Okay. Who is that? One of the very most important structure here. That is cavernous sinus. Who is it? Cavernous sinus. What do you mean by a sinus? Sinus is going to be like an irregular venous space. Okay, it's going to have irregular septa dividing in between, but it's going to be like a space having venous blood collected there. So we have the cavernous sinus on either side here, on the either aspect of the body of the sphenoid bone. And then we have these vessels. Do you remember this one? That's the internal carotid artery taking a loop again. And then we have this stem that is basically of the pituitary gland. And along this lateral wall of the cavernous sinus, we are having all these guys traveling to enter into the orbit. Okay, so can you see in this side? That's the orbit. So same way, these guys are traveling. These nerves are traveling to enter into the orbit. Who are all traveling? The first person, that this structure, uppermost, superiorly placed oculomotor nerve. Then we have this person, which is trochlear nerve. Next, we need abducent nerve. Where is it going? In relationship with the artery. It is not lying on the lateral wall of the cavernous sinus, but a little bit inferior to this internal carotid artery. So it's traveling inside the cavernous sinus. Okay. Next, we have this nerve. This is like one of the largest cranial nerves. That's our trigeminal nerve. Okay. So as the trigeminal nerve is emerging, we can see this ganglion, which is trigeminal ganglion, resting on the Meckel's cave. And then we have 1, 2, 3. 3 divisions of the trigeminal nerve. Okay. So the first one is the ophthalmic division. Next, maxillary division. And here we have the mandibular division. Okay. Now the ophthalmic division and maxillary division are again traveling in relation to the lateral wall of the cavernous sinus. And only the ophthalmic division is going to go for the eye. The maxillary division is going to go into foramen rotundum to enter into the space, into a space within the maxilla bone, which we'll study later. Okay. And the mandibular nerve is exiting through the foramen ovale to enter this region, that is infratemporal region. Okay. So as of now, you know these different nerves, they are all going in close relationship with the cavernous sinus. Okay, why am I stressing here so much? Okay. Do you know there is approach in neurosurgery called as transnasal transsphenoidal approach. What do you mean by that? Okay, you tell me, if a patient is having a pituitary gland tumor, okay, Pituitary gland is placed like right in the center of the like body of the sphenoid, which is like very much in the center. Wherever you go, like however you go, you might have to damage some portion of the dura mater or some portion of the brain to reach that spot. So what happened was some surgeons, excuse me, some surgeons found out that why don't we use this nasal pathway? Because just above the nose, we have this, just above and posterior to the nose, we have this cavity called a sphenoidal air sinus, which is a air sinus within the sphenoid bone. Okay. And just above that, we have the pituitary tumor. If we are approaching this way, we may not have to injure too many structures to reach the pituitary gland, isn't it? So that way we can remove the tumor easily with little bit of damage, not much. Okay. So when they're doing this approach, and we know that they are going to come here and for the pituitary gland, and just lateral to this, we have two venous sinuses, cavernous sinus. And if number one, they can damage the cavernous sinus, leading to like deadly bleeding. Number two, they can injure these cranial nerves, leading to any paralysis in the extraocular muscle. So they have to be very careful. If you are going to be a surgeon in future, you have to remember these structures. Okay, now after exiting, like after crossing the cavernous sinus, it's going to enter the orbital cavity, orbit through a fissure called as superior ophthalmic fissure. Okay, superior or orbital fissure, and then it's going to enter in a bunch like that and going for their respective muscles. So this is like the real picture. We'll see study one by one. And this is a line diagram showing the structures crossing the superior orbital fissure. This is very important from examination point of view. Okay, so you have this. What is this? Can you identify? There are like 4 muscles within it. So that's the tendinous ring. Okay, ring of Zen, annular ligament, ring of Zen, where we have the origin of all the rectus muscle. And here it is going to divide the superior ophthalmic fissure into 3 different compartments. So first, in the upper compartment, we are having certain structures entering. In the middle, someone is entering, and in the lower compartment, somebody else is entering. So their names will get familiarized in a few slides. So then we will come back to the slide later. Okay. But for examination, you can have this as a draw and label question. So the first nerve, okay, so it's oculomotor nerve. We know the nucleus is at the level of the superior colliculus, meaning it's a part of the brain's midbrain, where we had the motor nucleus of the oculomotor nerve. That level, there is a swelling that's called as superior colliculus, and it's going to emerge between the midbrain and the pons, runs in the lateral wall of the cavernous sinus, enters the orbit through the superior orbital fissure, and then it's going to divide into superior and inferior division. Okay, this we are encountering for the first time. So as soon as it's entering the superior orbital fissure, oculomotor nerve will just divide into 2 portions, superior division and inferior division. Okay, now here again it's a diagrammatic representation. We can see after it is dividing into superior and inferior division, the superior division is going to supply only 2 muscles. That is the people who are lying in the roof of the orbit. That is number 1, levator palpebrae superioris. Number 2, that is superior rectus muscle. Okay. So here again, see, oculomotor nerve has entered, dividing into 2 branches. Superior branch supplying levator palpebrae superioris, inferior branch superior rectus. Next we have the inferior branch, which is supplying the rest of the muscles. Okay. Next, trochlear nerve. This has a nucleus at the level of inferior colliculus. So I told you it's like going to wind around and come in the front. So it's going to wind around the midbrain, runs in again in the lateral wall of cavernous sinus, enters the superior orbital fissure, and if you remember the mnemonic LR6SO4, right? So SO4 means trochlear nerve supplying the superior oblique muscle. That's the only muscle it's going to supply. So here in this picture, can you see this, not this person actually, superior oblique, yeah, this person, right? So this is the cavernous sinus in the lateral wall, 1, 2, 3. From above downwards, we have oculomotor nerve, then the trochlear nerve, isn't it? So here you can see oculomotor nerve. This is the trochlear nerve. It has an interesting course, right? It's traveling, entering just medial to this ophthalmic division, and it's lying on top of these muscles, and it is going to supply the superior oblique muscle. You can again see the pulley. Okay, so this is like one of the nerves which you will get in the most superficial plane if you're doing a surgery. Okay, next nerve is abducent nerve, that is the sixth cranial nerve. This has nucleus at the level of lower pons, okay, meaning at the lower level of pons. Again, running through cavernous sinus, lies lateral to internal carotid artery, which we saw in the picture. Then it enters the orbit and supply the lateral rectus muscle. We know LR6, right? Lateral rectus 6 abducent nerve. So here in this picture, we can see. So here we had this nerve, and this is not clear in this image. Let me show you another picture, a cut section picture. Yes. So here, can you see this nerve, like which was like coming in? It is going to lie on the undersurface of the lateral rectus muscle. Okay. So this nerve is the abducent nerve. Okay. If you observe like any nerve, it is lying within the inner aspect of a muscle. Whether if you see it in the upper limb, lower limb, anywhere, it is going to be not superficial to that muscle. It's going to be like deeper to that muscle. You know why? That's again for the protection purpose. Okay, so if the nerve is going to be like exposed superficially, there are like more chances of damage, right? So this is being protected by traveling medial to that muscle. It is always like protected by the muscle. Okay, so that way we can figure out this is the lateral rectus muscle. Okay, now we will go for the next and most important branches. So do you remember the trigeminal nerve? So far we have learned about three cranial nerves, that is oculomotor nerve, trochlear nerve and abducent nerve, right? So now we are going to learn about the trigeminal nerve, which is the fifth cranial nerve. Okay, this trigeminal nerve, as you can see, it's going to give rise to three divisions. Okay, 1, 2, 3. The first division is called as ophthalmic division. This is maxillary, this is mandibular division. Ophthalmic division is the one which was like entering into the orbit. Okay, that's for our eyes. This is going to, as soon as it enters into the orbit, is going to give rise to three branches. Their names are nasociliary, frontal and lacrimal. Okay, nasociliary for the nose and the ciliary ganglion. Next we have the frontal, to the frontal part of the bone, frontal bone. Next we have the lacrimal nerve for the lacrimal glands on the side. So this is the order from medial to lateral aspect. Further, we have a mnemonic: National Football League, you can remember, and National, F for frontal nerve, football, L for lacrimal nerve, league. Okay, this is the arrangement from medial to lateral aspect. Now let's see starting from the lacrimal nerve, because its course is very easy. So here, as you can see, this is the ophthalmic division of the trigeminal nerve, and this is the first branch. Here we have see the lacrimal nerve, just like the lacrimal artery. Always remember, any nerve and artery is going to like travel together, almost a similar course. Okay, so they call it as like a neurovascular bundle. Okay, so now, so the lacrimal nerve is traveling on superior aspect of the lateral rectus. It's reaching the lacrimal nerve. Next, and next we have this nerve. This is one of my favorite nerves, because whenever we are like dissecting for the orbit, it's like not very easy to obtain all the small structures. But as soon as you like remove the roof of the orbit, this is like the first and the most amazing structure that you encounter. It's like very beautiful, it's big and it's very clear. Okay, that nerve is frontal nerve. Okay, and it's going to divide into two nerves, which is supratrochlear and supraorbital nerve. I told you, right? Its name is frontal. So its branches are going to come out and it's going to supply the forehead. If you remember from the scalp lecture, you will have the frontal belly of the occipitofrontalis muscle, which is supplied by the supratrochlear and supraorbital nerve. And the sensory supply, the sensory supply of the scalp, like in front of the auricle till the vertex, it is given by the supratrochlear and supraorbital nerve. Okay, so this nerve is like very important for like plastic surgeries. If they have to put a flap here, they make use of this nerve. Okay, Now, as you can see here, can you see this 1 and 2 nerves going to the vertex, giving to the sensory supply of the scalp? So that's the terminal branches of our frontal nerve. Okay. So far we saw about the lacrimal nerve and now about the frontal nerve, dividing into two important branches, supratrochlear and supraorbital nerve. Now we are moving on to the last nerve, which is nasociliary nerve. Okay. So for that you just have to cut the two muscles, because the rest of the two guys were lying on a superficial plane, but this person is going to lie a little bit deeper. Okay, because it has to supply different muscles. Okay. So here we can see below this levator palpebrae superioris and superior oblique, and just above the optic nerve, nasociliary nerve is going to cross from the lateral aspect to the medial aspect, similar to the ophthalmic artery. Okay. So when it is like crossing, it is going to give rise to certain communicating branches for this person. This is the ciliary ganglion. Okay. Then we are going to have some long posterior ciliary branches, and then it is going to again give rise to some ethmoidal branches. I told you here are the ethmoidal bones. So some branches for the uh, ethmoidal bones and ethmoidal air cells. Okay. And then finally it is going to terminate by dividing into two branches. One is anterior ethmoidal artery. Okay, this one was posterior ethmoidal. This is anterior ethmoidal artery. And then finally exiting as infratrochlear artery. Okay. So previously we saw supratrochlear and supraorbital nerve. Now we have someone called as infratrochlear nerve. Okay. So here can you see this portion, infratrochlear nerve emerging through the infratrochlear foramen. So this is all the branches of the trigeminal nerve. So in this lecture we studied about the three cranial nerves, that is 3, 4, 6, and then about the ophthalmic division of the trigeminal nerve. So here's a quick question, and for this you have to quickly recall that LR6, SO4 and the rest of the muscles by oculomotor nerve. Okay. A 62-year-old diabetic man presents with diplopia and drooping of the right eyelid. Okay. So at this point you should think, okay, he's a diabetic patient. Right. Next we have the diplopia, meaning double vision. Okay. Double vision means whenever the eyes are like not coordinated in the same plane, it will lead to double vision. Next we have, there is drooping of right eyelid. Okay. What can you think of now? So we know levator palpebrae superioris is a muscle which was like going to the upper eyelid, helping it to elevate the upper eyelid, meaning open the upper eyelid. Okay. Now, drooping of the upper eyelid means there is like a fall. They are not able to open the right upper eyelid. Okay. So it means levator palpebrae superioris might be affected. So what's the nerve supply of LPS now? It is going to be oculomotor nerve. You remember? Okay. So next. So on examination, the right eye is deviated down and out. I told you, down and out means only the superior oblique nerve, muscle, and the lateral rectus muscle are acting, meaning the fourth nerve and the sixth nerve are intact. Whenever the rest of the oculomotor muscles are paralyzed, okay, when they are not functioning, the rest of the two muscles are only acting, they are going to pull the eyeball down and out. Okay. So from this clue, we can derive which is the most likely structure affected. Obviously oculomotor nerve, and the pupil is normal and reacted to light. This will come back later. Yeah. Next we have a patient develops sudden severe headache, ptosis. Ptosis meaning again drooping of the eyelids is called as like ptosis, and a dilated fixed pupil. Okay, let go of this one. That eye is deviated downwards and laterally again. So whenever you see this down and out image, it's going to be oculomotor nerve paralysis. Okay. So compression of which structure is most likely? It's going to be oculomotor nerve. Okay. So now I told you like we'll go back to that line diagram of the superior orbital fissure. So here we can see this is the annular ring of Zinn, and here we have the optic canal through which we have the optic nerve and the ophthalmic artery entering the orbit. Okay. And here we have in the superior orbital fissure in the upper compartment, these guys are entering. Now I think you will be a little bit familiar with these names, that is lacrimal nerve, frontal nerve, Okay, you remember National Football League, F for frontal nerve, L for lacrimal nerve, isn't it? So that two branches of ophthalmic division of trigeminal nerve is coming through this part, and then we have someone here, that is the trochlear nerve. That is the trochlear nerve. That is the fourth cranial nerve. So for this, I have a mnemonic LFT, liver function test. We write, right? So same, you can use L for lacrimal, F for frontal, and T for trochlear nerve. LFT. Next, apart from this, in the middle compartment, we have the third nerve, which is like the most important nerve, oculomotor nerve. And then we have the remaining one of the ophthalmic division, nasociliary nerve. And then we having the sixth nerve, okay? So these three nerves are present. What happened, you can remember it like this also. Like instead of trochlear nerve, 3, 4, 6, instead of trochlear nerve, we have the one division coming here, and that trochlear nerve came there, okay? Here we have the nasociliary nerve. Cool. Next, we have two veins. Okay, one is superior ophthalmic vein, other is the inferior ophthalmic vein. So one is going like in the upper compartment, like above, and other in the below. And here we know ophthalmic artery is traveling inside the optic canal, so it's not related to this fissure. Okay, and here there can be a small recurrent meningeal artery, which is basically a branch of ophthalmic artery. Okay, so this you might have as a diagram question. Thank you so much, and I hope you understood a little bit, and hope it might help you for the exams. Thank you so much.